This is my first time in New Orleans and I'm absolutely in love with the city. I love this combination Spanish heritage and a little bit of French heritage.
APA is the biggest psychiatric conference in the world, so it's a big honor to be able to come in a way.
Just a lot of wonderful ability to be together and to strategize and to think about how we can move forward with supporting our patients and colleagues in their work.
We can see a lot of people from different regions and also from different countries and with different subspecialties, and we can share their views.
It's been a wonderful educational experience. It's been fun networking with colleagues, and being in New Orleans is also just wonderful. So all around, great conference.
It's the best place to connect with colleagues and get the very latest in scientific advances in psychiatry, with innovations and advances in technology aiming to achieve better mental health for all. We're here at the APA annual meeting in New Orleans, and you're watching APA TV. We're back. Welcome to our last show here at the American Psychiatric Association's annual meeting. As the event comes to a close, there's still plenty of exciting work to discover and important issues to discuss. Today on APA TV, we'll stop by a session looking at apps and innovations supporting psychiatry. And we'll take a look at some of the technologies, platforms and other resources providing new options for psychiatrists from around the world. Plus, stand by for a preview of our podcast discussing how to treat traumatized refugees. You can watch APA TV here at the Convention Centre, in your room at select hotels, and find us via the APA website, the APA app, or on YouTube and Twitter. You'll find extended versions of our content online, and watch out for our podcasts as we go in depth on some of the meeting's key issues. First, let's get a rundown of today's highlights with Petros Levounis.
Hello, I'm Dr. Petros Levounis, the incoming President-elect of the APA. Welcome to the last day of APA's 2022 annual meeting. It's been wonderful and many excellent sessions still remain. Today you can hear about the latest research on psychedelics in psychiatry, a clinical update on eating disorders, and using the DSM-5 TR outline cultural formulation, among other topics. You may want to drop by a session on medical mistrust in the role of psychiatrists can play in combating anti-vaccination efforts. Whatever you choose, there is so much left to take in. Thank you so much for coming to this year's annual meeting. I hope you've enjoyed everything you've seen, and I invite you to join us in San Francisco in 2023.
Make sure to stay sharp and take in some of those exciting final sessions. Now, in our first feature, we head to London, LA and Seoul to hear all about iMediSync, a company providing a 10-minute brain scan and the database needed to back it up.
When I had worked as clinical professor at Seoul National University Hospital, there were no solution for objective measure of brain dysfunctions. So I decided to start my research about brainwave.
I came across iMediSync because they produce this equipment which is made by clinicians for clinicians. And they've produced, to date, the best database there is for normative comparisons.
Because it's so simple and portable, iMediSync Wave opens the possibility of home use with telemedicine, helping professionals improve the lives of their patients.
Now they know what part of the brain it's affecting, how it's affecting their lives. Whatever we find as neuromarkers, we can attempt to optimize in terms of neuromodulation.
Our AI-empowered digital mental care platform services could change the mental care practice from knowledge-based to data-driven.
Let's go to a mental health technology company now whose goal is to identify biological markers to aid in screening of mental health conditions. Medibio have already made major breakthroughs in this area.
We see a future where a clinician has available to him or her an objective tool to manage on an ongoing basis well-being.
If you have high blood pressure, you get a blood pressure monitor and you test yourself at home. But there is nothing available for mental illnesses.
Medibio was founded in 2007 The aim was to find biological markers and patterns that correlated to mental illness.
Based on biomarkers, we have developed algorithms that pinpoint to a specific condition, in this case, depression.
At the moment, our trial is based on people that are going through a sleep clinic. We envisage a time where the patient will simply secure a small heart rate monitor. We will then collect the data and provide the result.
The next series of products is not just screening and diagnosis, but long-term monitoring.
We've seen some of those new technologies supporting psychiatrists, but let's take a look at the bigger picture as the session at the meeting helps give attendees an overview of the apps and innovations available today.
And then obviously COVID hit. We all had to virtualize our business operations in person, over video, over cell phone, patient portal, telephone, right? And each of those things have their strengths and weaknesses and boundaries of communication.
Well, forget about so early. I'm hard to get to. So I'm gonna pick up where.
So COVID, is obviously responsible for a lot of things, but during COVID, we've seen quite an explosion in technology and apps, haven't we, to do with psychiatry. Why do you think that is?
The pandemic really kind of pushed technology use in mental health into the forefront because we just had to. And organizations that were able to quickly pivot to technology such as apps or video conferencing were able to then continue that care.
There's a whole world of apps, of asynchronous tools, and I think it did in some ways open a door that we're still very much so exploring what it will mean for the field.
So what kind of apps are there out there?
It's kind of like anything on the internet. There's too many and it's hard to know all of them. Mental health apps are treating depression, anxiety, substance use disorders, even psychosis. As a clinician, how do you then rate the app, read enough about it to say, oh yeah, I'm going to recommend that to you. It's like saying, hey, I'm going to recommend to you a particular medication.
Yeah, we do have the American Psychiatric Association app evaluation framework. So it's a good resource you can Google. It's on the APA website. And it gives you some questions to ask about an app. It gives you some examples to look through. It kind of gives you a roadmap of when in this new complex landscape.
Thanks ever so much indeed. Such a fascinating area. Really enjoyed talking to you.
Great. Thanks for having us.
Let's hope to see those innovations bring positive change to mental health everywhere. Now let's go to Mindsigns Health, a company focused on brain health, providing EEG interpretation and analysis, and so much more.
The unmet need that Mindsigns is trying to address, first and foremost, is trying to provide a better access to care by being a remote platform, both for monitoring and assessment, to mitigate health inequity, providing a better access to care and hopefully a better delivery of care and improve outcomes.
We have developed algorithms to analyze large quantities of data in an objective manner. The algorithms for GenMind have been trained on hundreds of hours of data, specifically interviews between patients and psychiatrists. And these algorithms investigate different types of behaviors in the patients. They investigate, for instance, facial expressions, body movements, how patients speak, and what they speak about.
Neurobrowser is a cloud-based automated EEG software platform to monitor, interpret, and analyze EEG signals.
So the algorithms are modular, combine information from each individual channel and each short time segment, typically 1 second up to 10 seconds.
Now we're looking for collaborators, advisors, just people that are interested in what we're doing and want to come with us on this journey to impact healthcare in a meaningful way without the hype.
Now let's take a look at AI-augmented digital mental health tool already helping practitioners manage patients. It's OPTT Health.
The major challenge with mental health problems is that they are crude and ill-defined, subjective, and labor-intensive. So that is exactly what we are trying to solve in OPTT using data and AI. We have a range of disease-specific digital care plans and pre-designed content that the clinician can assign to their patients. At the same time, we are collecting more than 20 different behavioral, physiological, and clinical benchmarks and provide analytical feedback to the clinicians about the patient's progress, our prediction of the outcome of the care, and our suggestions for the next steps. What we are trying to facilitate is delivering high-quality outcomes at a scale.
It is very interesting that AI can help us with that prediction in a very short period of time rather than somebody like a team meeting and making that decision. And I think that's the future, and we're all very excited about that.
Modern Health is a comprehensive mental health platform that ensures members receive the right level of support at the right time. Let's find out how.
We see 2022 as the year that every employer is going to be investing in a mental health benefit for their employees. And we're incredibly proud and humbled to be able to support over 330 companies around the world.
Modern health means to me being innovative, being cutting edge, thinking about what century we're in and using the technology to be able to do that.
Whether that's through their phone, accessing it, through an app, seeing a really high quality provider, whatever that mental health care is, we want to do that in a way that's really friendly and accessible.
Adaptability, time to care, and ease of use really are the key differentiators we have in the market and continues to be the biggest ones.
The level of clinical rigor that we bring to our work is just something I'm so incredibly proud of. We really think through what are the ramifications, what does this mean for our members?
We are inviting companies to say, hey, you can change the culture at your job, at your place of employment by talking about mental health. And there's a trickle-down effect. Now we're all talking about mental health, we're all normalizing the language, and we're all seeking different types of resources.
Mentorship can have a major impact on some of the challenges that trainees face. Let's go to a group looking to provide the very best mentorship to LGBTQ+ trainees.
LGBTQ+ trainees are experiencing things that their non-queer counterparts don't experience on a daily basis. So there's the constant questions of whether to come out, whether you even have a choice of doing that, and people face constant discrimination and harassment from colleagues sometimes, but also from patients. And it's really difficult to navigate those situations. Mentorship is really key for helping LGBTQ trainees going into this space to anticipate challenges that they might face. I was able to find that through AGLP, which is the Association of LGBTQ Psychiatrists.
Through this AGLP mentorship program, we are hoping to connect medical students and residents who may not have robust options for LGBTQ+ specific mentorship, whether it's based on their identities, their gender or sexual orientation, their career interests, etc. Once we have a frame of reference of what is most important to the individual and the mentor, I feel like that helps create the most successful mentorship match.
One of the first mentors that I found at AGLP was Dr. Marshall Forstein, and he was so incredibly helpful for just helping me see that there was a path forward and that my identity and advocating for people like me and for my community was a strength.
Their name's Dr. Kevo Rivera. They are out loud and proud on social media, and through talking with them, seeing how they've navigated the professional experience, made their presence known on social media, I feel like has helped give me permission to do the same.
One of my mentors is Dr. Petros Levounis. He's wonderful, and he's always been there for me, even during times where I've doubted myself. There's not many LGBTQ individuals in medicine, and it's important for us to be representing our patients. I think it's important for us to share this lived experience and be there for each other as LGBTQ identified individuals. So please, if you have the chance, feel free to check out our session, Fostering a Mentorship Among LGBTQ Aspiring Psychiatrists.
We look at virtual support programs now provided by Marigold Health, helping retain patients in outpatient care by connecting them with trained peers.
Marigold Health has a mission to give people more agency in their recovery. And what we are is essentially a souped-up coaching program where we train people who are in recovery themselves to support patients today But what makes us really special is that that support is built on top of an anonymous recovery social network.
Marigold Health provides 24/7 anonymous group chat support to people who have behavioral health conditions. And the peers at Marigold are providing one-to-one support as well as app-based chat support to those folks who are interested in recovery.
And really, the goal also is to use this 24/7 engagement in these groups to also better connect that peer support to clinical care. So we have different AI and other technology systems that can pick up different needs as they're expressed in chats and set up follow-ups for other members of the care team. And Marigold has a way for you as a clinician to integrate that with the care you're rendering today.
Coming up, we go in depth on the challenges facing refugees and how to treat them. First though, in our final feature, let's go to Mobio Interactive, a Singapore-based company providing precision psychiatry at scale.
Mobio Interactive is precision psychiatry at scale. What we're really doing is we're releasing the tension that has historically existed between the ability to personalize and the ability to deliver psychiatry at scale.
We're moving to personalized health, and that includes things on the treatment side to personalized medicine, and it includes ways of integrating technology to bridge to the last mile of care, which is one of the hardest challenges that exists in private health and public health.
CHIO is leveraging the Mobio platform in different ways, one of which is an acute concussion population. The goal here is to increase resiliency and teach these children how to manage their stress and symptoms, so pain symptoms and emotional symptoms, in order to prevent rates of persistent post-concussive symptoms.
It's time now for our third and final podcast, where we look at the work being done to better understand the experiences of refugees and how psychiatrists can best serve them. Let's get a sneak preview of that conversation. And thank you very much indeed for talking to us today.
Well, I'm delighted to be here and to speak on this topic.
So as far as I understand, the UNHCR says that there are 100 million people around the world who are displaced, involuntarily displaced.
Yes, it's a huge problem, and the number of refugees has been growing dramatically over the last decade or so.
Give me some idea, if you will, about some of the distress, some of the stresses, conditions that refugees, displaced people will suffer from.
They are often traumatized and often suffer from the effects of the displacing agent, whether it's war or some other cause. Frequently they have psychiatric conditions, PTSD in particular. They are displaced to a culture that is not their own, often into a situation where they do not speak the language, usually without adequate socioeconomic supports on their part. So they are in very difficult situations and require a great deal of help to succeed as displaced persons.
So what's the role of the psychiatrist?
For many of the people who are displaced, they will have psychiatric conditions that psychiatrists are very accustomed to treating. The patient has to teach you about their story, their culture, the things that they have experienced.
How much of this do you think is down to trying to deal with medical conditions, and how much of this is just supporting as a society?
A lot of it is appropriate social support as a society. That's critical for people's success. I mean, we have learned a great deal about the social determinants of mental health. And that's the theme of this meeting, of course. Yeah, and that is probably doubly the case with people who are in refugee status or immigrant status. Nonetheless, the medical treatment of these individuals is very important, and psychiatric treatment as well. And they face tremendous barriers in getting appropriate treatment. So I do think physicians and the medical system have an important role to play, but I think that the social system has an even more important role to play with these folks. And so as a people, we are very good at bringing in folks from other cultures. However, we're not so good at providing these social services that we need.
Thanks ever so much indeed for talking to us. Really enjoyed it, so thank you very much.
Thank you so much for having me.
A challenging task for psychiatrists, but a very important work. Well, that's it, I'm afraid, from all of us here at the 2022 APA annual meeting. It's been an absolute pleasure, and we've covered everything from social determinants to youth mental health, apps to psychedelics. Remember, you can watch APA TV here at the Convention Centre, in your room at select hotels, and find us via the APA website, the APA app, or on YouTube and Twitter. You'll find extended versions of our content online, and watch out for our podcast as we go in depth on some of the meeting's key issues. Remember, all of our content, including extended features and in-depth podcasts, is available online and in perpetuity. Make sure to subscribe and share. APA heads next to San Francisco in 2023. We'll see you there for even more content from the world's premier psychiatric organization. So until then, goodbye and safe travels.